every year Nigeria have 115,000 new cases, new cancer cases, and I'm talking about those cases who got diagnosed and registered in the registry. I'm not talking about those who don't get opportunity to even reach out to the hospital. I'm just talking about the patients who got diagnosed in some government hospital and get registered. So every year Nigeria is having 119,000 new cancer cases. 5-year prevalence is 217,000 cases. Out of 119,000 cases, 71,000 cancer cases is of female and 44,000 is of male. Out of 71,000 female, 23,000 plus cases is only of breast cancer. So the problem, the cancer burden of Nigeria is this big. And we came here with a solution of it. We are treating Nigerians since many years now. Every year Apollo is receiving 100 plus patients in India. But our intention is not only to take patients from Nigeria to India, or for that matter from any other country to India. We are also trying our level best to do the capacity building at the country of origin where the patient belongs to. So in that matter, we have done some tie-ups with some Nigerian public and private sector healthcare providers. Out of those tie-ups, one is with Duchess Hospital, that is Reddington Hospital. Apollo is partner with Reddington Hospital and providing consultancy there. Also, I'm in talk with National Hospital to start some clinical programs. Just after this session, we have a continuous medical education session with Nigerian doctors, so that they will get to learn about new advancement in cancer care, and there will be exchange of knowledge and skills. So we are also focusing on capacity building. We are inviting Nigerian doctors and paramedics to our hospital and facilities for training purposes, for observership. We are also opening up information center in Nigeria, so that the patient need not to travel every time for the consultation and for the follow-up. Patient can get a consultation from Indian doctor while sitting in Nigeria. So we are focusing on telemedicine as well. So these are the few steps which we are taking to mark our footprint in the Nigerian market. Also, we are in discussion with many of the public healthcare providers so that we can come up with some greenfield project where we can have our own comprehensive cancer center in Nigeria. So those talks are also going on. Regarding proton cost, which sir was asking from Dr. Sapna, the cost of the proton is $65,000, evaluation to treatment to everything. So the cost of proton, because as Dr. Sapna mentioned, it's a very expensive technique, and we are the only one who acquired this technique in the whole of Southeast Asia. But proton is one of the options. It's not the only option. With Apollo, we have all kind of radiation machines available, from CyberKnife to normal linear aspirator to tomotherapy. So we give actually choice to the patient, and it depends on the patient's affordability and comfort what he choose. So we exactly in Apollo, patient can actually take a very aware decision about his treatment. So as we have all the options available under one roof, we give all the options to the patient with the benefit.
No, I practice medicine in India, and I have to mention that proton therapy is an extremely expensive technology, and even in India there is only one center. In fact, this is the only center in South Asia, Southeast Asia and Middle East. And the reason for that is that it's an extremely expensive technology. So yes, at present, people from our country as well as the rest of the world who choose to get treated with us have to travel to Chennai to be treated. As far as preventive health is concerned, I do believe, I'm a strong proponent of that, and in fact have done a lot of work, including, talking to school children as a part of my role as an advisor to an NGO called Global Cancer Concern. However, that's not really my role here today and not my brief here today.
Damages caused on the normal body tissue with proton therapy is very much minimal compared to the other. That's just the advantage it comes with. So it's more precise. It's like you have this and you just have the tumor here and you just focus on the tumor and it releases large energy to damage the cancer cells without damaging the normal body tissues. So on cancer prevention is entirely a different conversation on its own. But a way of preventing cancer, because some cancers we know the cause, many of them we don't know the cause. But what is encouraged is checking out when you pick it early, early diagnosis, which they're also working on with our oncologists to ensure that our capacity as a country to diagnose cancer much earlier and also diagnosing it accurately is improved. Because some of you might know a case in Benue State University Teaching Hospital, someone that went